When a loved one is really sick and you start thinking about the pain they might be in, it's a tough thing to think about. And when you start thinking about, strong pain medications, there's a lot of fear around that whole topic, isn't there?
Mm.
And that's exactly what we're going to dig into today.
Yeah.
We're going to really try to unpack how pain is understood and how it's managed, especially when we talk about something called palliative care.
That's right, because I think when people hear palliative care, the first thing that pops into their mind is end-of-life care. And then immediately people think about, pain that is just unbearable or about medications that they're afraid of.
Right.
So we're trying to dispel some of those anxieties about palliative care. It's a much broader approach to improving someone's comfort and quality of life when they're facing a serious illness.
Exactly. And you don't have to be a doctor to follow along with us today. We're going to keep things really straightforward. We're not going to use all the fancy medical jargon. We really want to just give you practical knowledge. So whether you're supporting a friend or family member who's going through this, or you're just curious about how healthcare professionals approach this topic of pain, or you simply want to be a bit more informed, this deep dive is really for you.
Absolutely.
Our goal is to try to take away some of the mystery surrounding pain and really explain how thoughtfully doctors and nurses think about it.
Mm-hmm.
And how they work to manage pain, especially within palliative care.
Yeah.
And also, just to give you some insight into how you can offer support,
Yeah.
we really want to highlight that modern pain management can be incredibly effective in relieving suffering.
Absolutely.
And it's really all about improving well-being. So today we're basing our discussion on expert guidelines for how healthcare professionals assess and manage pain in palliative care.
That's right.
So, we've looked at the approaches that are used in clinics and hospitals and the conversations among doctors and nurses to bring you what we think are the most important insights.
That's right.
So let's start with understanding pain itself. It's so much more than just a physical ache or discomfort, isn't it?
It really is. Think about a time when you had a bad headache.
Yeah.
It wasn't just the throbbing in your head. You probably felt irritable, unable to focus, maybe even a bit down.
Oh, yeah.
That gives you just a tiny glimpse into what we call total pain in palliative care.
Okay.
So total pain is a really key concept here. It recognizes that when somebody's hurting, it's not just a physical sensation in their body.
Oh, yeah.
It's intertwined with, their psychological well-being. Are they feeling anxious? Are they feeling scared? Their emotional state, are they sad? Are they frustrated? And even their spiritual beliefs can play a role in their sense of meaning in life. So while asking where does it hurt is, the first step, it really only scratches the surface of what that person's actually experiencing. So the takeaway here is it's not just treating the body part.
Okay.
It's understanding the whole human experience of suffering.
Okay, that makes a lot of sense because you're right. When somebody's dealing with a serious illness, the physical pain that they feel is probably mixed up with a whole range of other difficult emotions and anxieties about their future, about their illness.
Yeah.
So how do healthcare professionals even begin to understand all those different layers? Because it sounds really complex to me.
It all starts with listening to the person's story, creating a safe and comfortable space where they feel like they can describe their pain in their own way.
Okay.
And that means asking open-ended questions like, tell me about your pain, and really resisting the urge to interrupt them or to jump to conclusions.
You're right.
It's about letting them paint a picture of what they're going through.
So it's a lot more than filling out a chart with a number on it.
Yeah, exactly. So while we do have tools and things, the patient's own account is the most important. And it's not just about what they're telling us. We also pay close attention to what we observe. How does the person look? Do they seem restless, agitated? What about their face,
Wow.
Are they clenching their jaw? Are they frowning? Are they tense? Unable to get comfortable? Even the sounds they make, like, moaning or sighing. These are all clues, especially for people who might not be able to easily tell us about their pain.
Right, and that's such an important point because a lot of us who are supporting people through this might be with somebody who's not able to communicate verbally.
Yeah, absolutely.
So just being observant can tell you so much.
Absolutely. And then we also try and understand what the pain means to the person. Why do they think they have this pain? What's their understanding of it? And that's why building a therapeutic relationship is so important, because then we can start to explore some of these, deeper personal aspects of their experience.
So it's a very person-centered approach.
Yeah.
Rather than just, treating the physical symptoms.
Absolutely. And, part of this is being realistic right from the start. It's really important to be honest with the person and to never promise that we can completely eliminate their pain.
Right.
That might not be possible. Instead, what we focus on is managing the pain and improving their overall quality of life. So helping them to live as fully as possible.
So it's about, finding a level of pain that allows them to still engage in the things that are important to them.
Yeah, absolutely. And that's why we also need to understand what the person's goals are for their pain management. What do they hope to be able to do?
Okay.
Do they want to get a good night's sleep? Do they want to have enough energy to do things around the house? Maybe they just want to feel less anxious, be able to spend time with family and friends and really enjoy those moments. We use those goals to help guide the treatment plan.
Right.
So, for example, when we're assessing pain, we might ask, how much does this interfere with your ability to work, your mood, your relationships, and your enjoyment of life? These are the things that matter to that individual.
That makes a lot of sense. It shifts the focus from just the number on the pain scale to what's actually meaningful for the person experiencing the pain.
Yeah.
Now, you mentioned pain scales earlier. How do doctors and nurses typically assess pain?
Yeah.
Is it mostly about those, 0 to 10 charts?
So while those traditional pain scales, where somebody rates their pain on a scale from 0 to 10 can be helpful in some situations, they do have limitations, especially in palliative care. So for people who are very frail or for people who come from different cultural backgrounds, those scales might not always be the most accurate way to understand their pain.
Yeah, I can imagine, because a number might mean different things to different people.
Absolutely.
Or somebody who is very unwell might find it quite hard to even use that kind of tool.
Absolutely. And that's where assessing pain in people who can't speak for themselves, becomes really important.
Right.
So if somebody has dementia, for example, or somebody who just cannot talk, we rely on what's called a 360-degree assessment.
Okay.
Because the traditional pain scale doesn't really work, in these situations, especially for our most vulnerable patients. So we try to look at all the clues.
Right.
So this involves gathering information from, everybody who's involved in their care. We'll ask family members or caregivers, especially those who help with daily activities like washing or feeding. Have you noticed any changes?
Right.
And then we'll observe the person ourselves. Are they restless? Are there changes in their mood? Are they doing things that might suggest they're uncomfortable, like refusing to eat or pulling away when they're being cared for?
Yeah.
And sometimes, if we're really concerned, we might even try a pain medication and carefully watch to see if it makes a difference.
Wow. Okay.
Yeah.
So it's really about putting together all the pieces of the puzzle.
Absolutely. And then how somebody's able to do their everyday activities. That's a really key indicator.
Right.
So if we see improvements in their ability to function, maybe they're sleeping better, maybe they're more active, they're interacting more.
Yeah.
That can be a really good sign that our pain management strategies are working.
Yeah. I mean, that seems like a much more meaningful way of seeing whether things are improving than just focusing on a number.
Absolutely. And we also need to be very aware that different cultures and language barriers can really affect how somebody describes their pain and how we understand it. And sometimes fear and worry can lead people to underreport their pain. So that's something that we always need to be mindful of.
Right. It's like they might be concerned about bothering people.
Yeah.
Or, taking too much medication.
Absolutely. Or they might have concerns about side effects or what the medication means for their illness.
Right.
So, it's about creating a space where people feel comfortable and supported to be really honest about how they're feeling. And then for specific groups of people, like those with dementia or even young children, there are specific tools that have been developed to help with this.
Okay.
So there are things like the ADD protocol and the Abbey scale, which helped us to look for more subtle signs of pain in people with dementia.
Okay.
And then for children over 4, there's the revised FACES pain scale, which uses pictures of faces showing different levels of discomfort.
Interesting.
Yeah.
So it sounds like there's a whole range of ways to try and understand someone's pain as accurately as possible, even in challenging situations.
Yeah.
So once the doctors and nurses have a good understanding of the pain, how do they actually help? What does pain management look like in practice?
So it's about creating a care plan that's specifically designed for that individual and their family's needs.
Okay.
There's no one single approach that works for everyone.
Right.
But there are some important guiding principles that we use. One of the key sets of ideas comes from the World Health Organization, and we often refer to these as the WHO pain treatment principles.
Okay, so let's dig into those a little bit. What are some of the main points?
Yeah, so there are four main ideas. The first is by the clock.
Okay.
So for pain that's persistent, it's much more effective to give pain medication regularly at set times rather than waiting until the pain gets really bad and then trying to catch up.
Okay.
So it's about treating pain proactively
Right.
to keep it under better control. Think of it like this. For ongoing pain, it's better to take your pain medication regularly, like setting an alarm, rather than waiting until the pain gets really bad, like trying to put out a fire that's already raging.
Okay, that makes sense.
Yeah,
So you're trying to stay ahead of the pain instead of always reacting to it.
exactly.
Okay.
The second principle is by the mouth or by the appropriate route.
Right.
So taking meditation by mouth as a tablet or liquid is usually preferred whenever possible because it's the easiest, most convenient way. However, if somebody can't swallow or they have a lot of vomiting, then other ways of giving the medication, like injections or patches, might need to be considered.
Okay.
And then the third principle is by the individual, which means that pain management has to be tailored to the needs of each person.
Okay.
What works well for one person might not work as well for another.
Right.
So it's about finding the right medication, the right dose, and the right schedule for that individual.
Okay, so it sounds like a really person-centered approach.
Yeah.
Moving away from a purely, biological understanding of pain.
Yeah, absolutely.
And the final principle.
Yeah, and the final principle is by the ladder.
Okay.
So this refers to a step-by-step approach to pain relief. So generally, we start with milder pain relievers,
Right.
and then we move up to stronger ones if needed.
Okay.
So for adults, this might mean starting with simple pain relievers that you can buy over the counter at a pharmacy or a shop, and then moving to what we sometimes call weak opioids, and then strong opioids if the pain continues.
Right.
So it's about starting with the gentlest effective option and then escalating carefully as needed. But it's important to remember that this ladder isn't always followed exactly step by step.
Okay.
If somebody has severe pain to begin with, we might need to start with stronger pain relief to get it under control more quickly.
So it's a flexible guideline
Yeah,
that can be adapted depending on the person's individual situation?
absolutely. Another way that we think about, this comprehensive approach is what we call the chef-Dytha method.
Okay.
So, imagine a ship, and the hull of the ship is all about communication, support, and information for both the person experiencing the pain and their family.
Okay.
So this involves talking about their current pain treatment, doing really thorough pain assessments, really listening and talking with everybody involved.
Right. Communication seems like it would be absolutely key in managing something as personal as pain.
It's absolutely fundamental.
Right.
And alongside the communication, the eShep-E method also emphasizes non-drug methods. So the things we can do to help with pain that aren't medications.
Okay, like what kinds of things?
There are so many different options, and they can be very helpful.
Right.
So, for example, for newborn babies who are having a little procedure, giving them some sugar solution can actually help to reduce pain.
Oh, wow.
Yeah. So for older children and adults, things like, gentle massage or applying heat or cold packs, relaxation techniques, acupuncture, or even just distraction like, doing a hobby or spending time with loved ones.
Right.
All of these things can play a role. So if somebody's experiencing anxiety along with their pain, a calming aromatherapy scent or a gentle massage can sometimes reduce their need for higher doses of medication.
It's interesting how many different ways there are to actually help besides just taking medicine.
Absolutely. And then, of course, we have medications.
Right.
So for mild pain, we might start with basic pain relievers like paracetamol or ibuprofen, the kind of things that you can often buy over the counter.
Yeah.
In babies under 3 months old, paracetamol is usually the only pain reliever that's recommended.
Okay.
And then we have what we call weak opioids and then strong opioids for more severe pain.
Now, I know that the idea of strong opioids can make some people anxious.
Mm-hmm.
There are a lot of concerns out there about those.
Yeah, absolutely. And it's really important that we address those concerns.
Right.
It's vital to understand that in palliative care, when these medications are used appropriately to manage pain related to a serious illness, the goal is always to improve the person's quality of life
Okay.
and to relieve their suffering.
Right.
We'll talk a little bit more about some of the common worries in a moment.
Mm-hmm.
But it's also important to know that there are other types of medications that can be used for specific types of pain. So, for example, for nerve pain, which can feel like a burning or tingling sensation, Doctors might prescribe medications that come from the antidepressant category or the anticonvulsant category.
Okay.
And these can help to calm down those overactive nerve signals.
Right.
We also have what we call rescue doses
Okay.
for breakthrough pain.
Right.
So that's when pain flares up suddenly, even when somebody's taking their regular pain medication.
Okay.
And this can happen predictably, like maybe before a certain activity, or it can be unpredictable.
Right.
Doctors will often prescribe a fast-acting pain reliever to be used as needed in these situations.
Right. So it sounds like a really comprehensive approach.
Yeah.
Using different tools for different types of pain, different situations.
Absolutely. And managing pain effectively often requires a team effort. So, we have doctors, nurses, social workers, and other healthcare professionals all playing important roles. Social workers, for instance, are incredibly helpful in addressing the fears and misunderstandings that patients and families might have about pain medications like morphine.
Yes. Let's talk more about some of those common worries, because I think that would be really helpful for our listeners
Okay.
to, understand those a little bit better.
Absolutely. So one very common concern is addiction.
Right.
And it's important to understand the difference between physical dependence and addiction.
Okay.
So physical dependence occurs when the body gets used to a medication. And if you stop it suddenly, you might experience some temporary withdrawal symptoms.
Okay.
Addiction, on the other hand, is this really strong psychological need to use the drug for reasons other than pain relief, even if it's causing harm.
Right.
So in palliative care for people with serious illnesses, when opioid medications are used to manage pain, the risk of addiction is very low.
Okay.
Because the focus is on providing comfort and improving quality of life, and the need for that medication is carefully monitored.
So it's really important to understand the difference between dependence and addiction.
Yeah.
So dependence is something that the body might experience.
Yes.
Whereas addiction is much more of a psychological issue.
Absolutely. Another worry that people have is about ceiling doses. So the idea that there is a maximum dose of a pain medication, and beyond that, it's not going to provide any more relief.
Okay.
That's really not the case. We adjust the dose based on the individual's needs and how they respond. And then there's the misconception that if somebody's prescribed a strong pain medication like morphine, it means that they're very close to the end of life.
Right.
While morphine is often used in end-of-life care to ensure comfort, it's also used at earlier stages of illness to manage pain and improve quality of life.
Right.
It's not about predicting or hastening death.
Yeah.
It's about relieving suffering.
Right. It sounds like these medications are really tools to help people live as well as possible for as long as possible.
Absolutely.
Okay.
And then finally, people often worry about the side effects of these strong pain medications.
Right.
So while side effects like constipation and nausea can occur, they're usually anticipated and managed proactively.
Okay.
So, for example, laxatives are often prescribed to prevent constipation.
Right.
Nausea is often temporary and can be treated with other medications if needed. So it's not just about giving the pain medication and hoping for the best.
Yeah.
There's usually a whole plan in place to manage any potential side effects.
Right. So it's about finding the right balance between controlling the pain and minimizing the side effects.
Absolutely, to ensure the person's comfort and well-being.
Right. Well, this has been a really helpful insight, I think, into how doctors and nurses manage pain. But what about those of us who aren't medical professionals?
Yeah.
What can we do to help someone who's experiencing pain?
There's actually a lot that non-medics can do to provide support and make a real difference.
Okay.
I think one of the most important things is just to really listen when the person is talking about their pain. Without judging them or trying to minimize what they're going through.
Okay.
Pay attention not just to their words, but to their body language and their facial expressions.
Okay. So maybe instead of just asking, are you comfortable?
Yeah.
We could ask something a bit more specific.
Yeah, absolutely. So, are there any positions or things that make you feel more tense or less comfortable right now,
Right.
for example?
So just being present and really paying attention can be a big help.
Absolutely. And then providing comfort in simple ways can also be really helpful.
Okay.
So this could be like helping them find a more comfortable position in bed or in a chair, offering a warm or cool compress if that's something they find soothing, and if their healthcare team has said it's okay, just making sure that the environment is calm and peaceful.
Yeah.
These simple things can really make a big difference.
Right.
And emotional support is so important. Remember that pain has those emotional and spiritual aspects that we talked about. Offering a listening ear, a comforting presence, and understanding can be so helpful. It's about acknowledging the whole person, not just the physical pain.
Right, exactly.
You can also help by making it easier for the person to communicate with their healthcare team.
Right.
So if they're finding it hard to explain their pain, you could offer to help them to describe how they're feeling, especially if there are any language barriers.
Right. So acting as an advocate in a way.
Absolutely. And as we discussed earlier, being aware of those nonverbal signs of pain is really important, especially if the person can't easily tell you how they're feeling.
Right.
So, changes in their behavior might be a sign that they're in pain. And if the person or their family has concerns or fears about their pain medication, you can gently encourage them to talk about this with the doctor or the nurses who can give them more accurate information and reassurance.
Yeah, that's a good reminder not to just dismiss those fears, but to try and guide them towards the right people to get the answers.
Absolutely. And finally, if the person is taking pain medication on a regular schedule, helping them to remember to take it at those times can be really important
Right.
to help keep their pain under control.
So it's a combination of practical help, emotional support, and just making the communication with the medical team a bit easier.
Absolutely.
Well, this has been a really helpful deep dive into understanding and managing pain in palliative care.
Yeah.
I mean, to just quickly recap some of the main points we've learned that pain is so much more than just a physical sensation.
Yeah.
It involves our emotions, our mental well-being, even our sense of purpose.
Yeah.
And effective pain management in palliative care is really personalized.
Yeah.
It focuses on what matters most to that individual.
Yeah.
And while we can't always promise that pain will completely disappear, the goal is always to provide significant relief and improve that person's quality of life.
Absolutely. And it's so important for our listeners to take away that pain can be managed very effectively with good palliative care.
Right.
This old idea that severe pain is just an unavoidable part of serious illness is just not true.
Right.
There are many effective approaches, both with and without medication, and a good healthcare team working together with the patient and their loved ones can make a huge difference.
Absolutely. And that brings us to our final thought for today. Given how multifaceted pain really is, what small shifts in how we listen to and respond to those in pain could have the biggest positive impact on their well-being.
Yeah.
So think about all those non-physical aspects that we talked about today. I mean, even just changing our own understanding and attitude towards pain and how it's managed could be a really powerful first step.
Yeah.
If you're interested in learning more about palliative care and pain management, we encourage you to look for some reliable resources in your community or online. Thank you so much for joining us for this deep dive.
Thank you.